Our healthcare system is at a breaking point. We don't have enough clinicians.
Unfortunately.
We don't have enough, and we have a population that is aging at an unprecedented rate.
Hello, this is Alastair, and welcome back to the Venture Variety Show. This podcast is where I talk with founders, investors, and operators about how startups and the stories around them get built. Today's guest is Liz Tarullo. She's co-founder and CEO of Nolia Health. And Liz and her team are building a tech-enabled healthcare service that focuses on family caregivers. Liz's journey began with a personal crisis. She talks about how her father had a stroke and the care he needed afterwards. And Liz mentions how she has since grown a venture-backed company that combines clinical services with AI-powered tools to help fill one of the largest gaps in healthcare today. In our conversation, Liz talks about how policy changes opened up new business models, why scaling caregiving support requires human empathy and AI efficiency, and she talks about what it means to build in a system she says is already at a breaking point. So let's jump in and meet Liz. Liz, welcome to the show.
Thank you so much. I'm really honored to be here today. Thanks for having me.
Well, tell us about yourself and the company, Nolia Health.
Yeah, absolutely. Thanks. So Nolia Health is focused on bringing family caregivers into the healthcare system through clinical guidance and AI-driven support. And it's really aimed at the 53 million family caregivers of older adults today who are navigating a very challenging life transition of taking care of an aging adult. We see kind of a big gap between the healthcare system and the care that's getting delivered in the home, and see immense opportunity to deliver clinical, emotional, and practical support for family caregivers who are truly the first responders in the home and really, very responsible for kind of driving health outcomes for older adults. So we're totally covered by insurance and currently serving patients across Washington state and expanding into California later this year. My background and how I came to found Nolia Health, I got into startups actually right out of school. So on the founding team at Venture for America, was scaling that program nationally. And then my father had a stroke early in his life. And so early in my life, I was confronted with the question of how am I going to take care of my parent? My stepmom and I became family caregivers, and that's what led me into healthcare. Joined a venture-backed startup in the caregiving space, really understood what it takes to deliver care in the home, and kind of saw firsthand how an investment in the person who's there kind of day in and day out, largely outside of the healthcare system, translates into improved health outcomes for the older adult. For me, the kind of issue facing unsupported family caregivers just continued to loom large. So along with my founding team, I have an incredible set of co-founders representing clinical and technology. We came together as folks who have experienced this firsthand to really set out to imagine a new way forward for family caregivers of aging parents, as more and more of us find ourselves in that position.
I'm a Gen Xer. I've been in that situation with aging parents. A lot of us have. I can imagine it's a common situation, and growing as well. How exactly does the company implement or use AI in your services?
Yeah, so I would really classify us today as a tech-enabled healthcare service company. We really are led by clinicians, and the clinical service that we deliver is core to how we drive the kind of change that we want to see in the world. But it's really an immense opportunity and privilege to be able to be building a company of this sort at this time, because the ability to embed AI in sort of everything we're doing to drive efficiency, to create value in terms of kind of the learnings we can have over time as we continue to drive more and more touch points. We deliver everything virtually. We're exclusively telehealth service. We have an AI really embedded in, the caregiver kind of forward-facing experience. We were able to launch a co-pilot Noli pretty quickly that's grounded in kind of the most recent clinical studies and best practices around taking care of older adults. We've also been able to implement AI on the operational side. And again, how can we use this as a tool to help our clinical team not focus on charting, not focus on billing, but focus on connecting with the family caregiver who's really in need of that kind of personalized attention and support. So we can kind of talk more specifically, but I think for us, it's allowing, what maybe would have been a very operationally difficult kind of company to scale, to leverage the efficiencies of personalization and kind of always learning and streamlining and automation,
Hmm.
to be able to grow much faster, on a lot less capital.
Is there a misconception about AI in healthcare that you wish more people understood, that it's not, people are still involved. The caregivers are still the main part of the service?
Yeah, I think I see technology not as a replacement, but as an enhancement. I think what AI is able to do is allow what previously needed to be a very kind of personalized experience, to be able to scale that, to bring to bear kind of the latest clinical interventions, to bring, a lot of what we're doing, and maybe I could get into a little bit more specifically how it works. We work with families over time. We get a referral typically from their physician following a diagnosis, let's say of dementia, so kind of a life-changing diagnosis. The current experience is that family caregiver is left to sort through the new normal and get up to speed on benefits and how to handle behavioral symptoms, how to manage finances, how to coordinate kind of a broader care team. There's a ton of responsibilities kind of placed on them and a steep learning curve. And a lot of us have navigated that on our own, but expertise exists and support exists. And so, what AI has allowed us to do is bring a lot of those insights kind of in a personalized way right to that moment in time where we're coming in right after a diagnosis with a warm handoff from the physician and able to work with them over time to put in kind of a personalized care plan that's focused on prevention, it's focused on holistic support, and it's flagging any kind of changes that are happening in the home before an acute care episode. So I think at the end of the day, it's really about bringing an expert and a support system to a family caregiver and doing that in a way that is consistent and convenient and clinically validated. And that is at its heart today for us a human to human interaction, but augmented and really enhanced through kind of the ease of being able to access and personalize that information with AI.
It sounds like it's still very human focused, but where does the tech enablement come into play with with the at home caregivers, for instance?
Yep. So we're primarily serving spouses or adult children of older adult living with a chronic condition. So AI really, initially it's ingesting kind of the medical record and any of the background that we're getting from the referring provider so that our initial visit with them, we are prepped. They don't have to repeat information. Our clinicians have kind of at their
I see.
fingertips the full picture. And then we're able to jump into, what are some of your biggest barriers to care? How can we put together kind of a daily routine that ensures that we're thinking about how to slow the progression of this disease down? We're handling any of the kind of disease education or kind of treatment compliance needs that the provider has flagged for us. All of those sessions then are, building a really robust profile from our standpoint of who this person is and what they're dealing with. That changes over time. We're primarily serving older adults, family caregivers of older adults living with dementia. It's a progressive condition. It's always changing. So having kind of that continuity of vision and what have they already tried and what has worked so that they don't have to repeat it every time is pretty important. And we're meeting with them in a clinical visit setting that's again covered by insurance each month. But in between those touch points, they may be interacting with us via additional therapy, focused for the family caregiver to get the emotional support they need, caregiver training workshops, peer to
Mm.
peer support groups. And then they also have access to our companion app that has kind of 24/7 support. They can also access resources. So we partner with some, incredible providers of training materials and video content that's delivered in like a much more digestible way. There's a search experience where any question they might have similar to a chat GPT, but it's personalized to you and it's grounded in clinical evidence. So all of that is accessible kind of in between those appointments.
Mm. And the online 24/7, access point, that's what you call Noli? That's what you've
That is
nicknamed?
Noli.
Yeah,
Yes, yeah. So that is Noli. We have a clinician in the loop model. So all of the responses are reviewed by our team to
I
ensure
see.
kind of highest clinical quality. But we were able to get started. Our founding clinicians and clinical team members had deployed this type of caregiver focused model in a community hospital setting and ran that for about 10 years, manually creating these care plans, right, over time with the resources. We were able to take all of that data and use it to kind of initiate our initial large language models and get up to speed much, much faster. Now, our care navigators are with a click of a button following a session using AI to create care plans that are personalized. So it's really, really, it has cut down the amount of time that they're spending researching and building.
And to be clear for those tuning in, there are LLMs, but I wouldn't call this agentic tech, right? This is although it's tech enabled, like you said.
Yeah. We're not agentic. We have a vision around it. I mean, there's actually we're starting to trial that. Some of the biggest pain points we've heard from our caregivers is calling and booking appointments for the people, for the level or for the person living with the condition that they're
Right.
taking care of, researching what their benefits are, looking into long-term care options. So as much as we can, as much as our team and eventually our technology can take some of those more administrative tasks off of their plate to free them up to go take care of themselves, that's the goal and that's what we're following.
You mentioned the clinical specialists who review the data,
Yeah.
review the material. How many people are involved with that operation?
Kind of our cross team, and we're able, call it 5 today.
Yeah. Okay.
It's really our transdisciplinary clinical team. So we've got nurse practitioners, a medical director, clinical neuropsychologists, licensed clinical social workers. So a team really reviewing to ensure kind of the highest quality. But what we're able to with this nimble team of cross-licensed clinicians really scale in terms of clinical guidance is pretty incredible.
What type of feedback are you getting? It sounds to me as though for the customers, the patients involved, and their family members, there's still a human touch. That this isn't automated. It's not robotic. It's not entirely. It's not like putting something into Chat GPT. Not that there's anything wrong with that, but it's not like you're just adding prompts and data and getting results. There's a human element. And
Yes, it's personalized to them. I mean, because we're dealing with healthcare, we had to create individual models for every user, right? We're
Mhm.
talking about their kind of protected health information. So it's hyper personalized and absolutely there is always an ability to escalate to a human and there is a clinical oversight to it. So what we're, hoping to deliver is really convenient, timely access to information that matters, but we're proactive in our interactions and like you said, to really emphasize that kind of human to human connection point, because ultimately, when we think about our clients and who we serve, they're often coming to us in a state of crisis and overwhelm. And
Mhm.
technology and convenience can be used to, standardize, make it efficient. But what's really important is to be seen and to be validated and to be helped first and foremost. And right now, what we found is what resonates with the folks that we're serving is that human to human kind of clinical service augmented by just ease of access and convenience and ability to kind of get your questions answered quickly.
This would look like a lot different if it was founded, what, 5 years ago?
Uh, yeah. Yeah. I mean,
Or
and
3
and
years even.
I guess to pull that up a level, we couldn't have founded like we really couldn't have done the work we're
Right.
doing in the way we're doing it, both from a technology standpoint as well as an insurance coverage. So thanks to the previous administration's focus on recognizing the role of the family
Mm.
caregiver, federal policy shifted to be able to introduce codes that for the first time were covering services that were aimed not just at the Medicare beneficiary or the patient, but on their support system kind of around. So it's really, really opened up a ton of potential for innovation, right? We're billing codes that weren't available 2 years ago.
Where do you see this going? Where do you see the future of healthcare and caregiving specifically when it comes to using AI?
Well,
What's
I
your
think
outlook? Yeah,
Yeah, I
sorry.
mean, I think our healthcare system is at a breaking point. We don't have
Mm,
enough clinicians.
unfortunate.
We don't have enough, and we have a population that is aging at an unprecedented rate. More and more of us. If you haven't already found yourself in the role of taking care of an aging parent, we all will at some point. And most people want to age in place. Most people want be taken care of by their community. So whether it's, a couple of hours a week of just managing medications and overseeing kind of bills and coordinating some form of transportation or, you know, daily in-person caregiving, we will all be affected by this. And the healthcare system needs these individuals who are just stepping up, finding a way out of no way because most people can't afford to pay for paid caregivers to come into the home, especially with some of the changes, right, we're seeing on immigration and everything else. The cost of paying for that care is going to be inaccessible to most people. So the vision I think for the future is we're moving towards a world where embracing kind of the multifaceted nature of what it means to be human, to work and to care for each other is just part of how we meet the demand. And having a tool, an always on, clinically validated tool that can act as an assistant and a support system in that life transition, in that role. I think we see it with new parents. I mean, I'm a millennial new parent. The number
Mhm.
of apps and just we're catching the wave of the next generation. I think of caregivers that just expect that there is a personalized, kind of researched support system guiding me through this experience that is really challenging.
And you mentioned generational differences, and the generations coming in will be obviously, I mean, I could speak to my sons who are very tech savvy and expect everything to be connected to tech,
Yep.
right? I mean, they don't even
Yep.
like to use the phone,
Yeah. No. I want to
unfortunately.
personalize, want to
Yes.
instantly accessible, kind of great visibility and yeah, the ability to tap into expertise as you need.
And do you see it sounds well, you tell me, I don't wanna put words into your mouth. It sounds like there's a role for AI in all this and tech in general.
I think it's a must. Yeah. I think
Yeah.
some of the one thing I didn't talk about that we also offer are virtual diagnostics.
Mhm.
There aren't enough neurologists or, clinicians to even do the initial diagnostic to get a sense of, what's happening in the home. So one area that we've seen a lot of traction or really resonated are in more rural communities where we're able to come in and provide a desperately needed service around virtual diagnostics that then feeds directly into this treatment or the support program, right, that we offer following that. I think that it's a broken system today, and there's a lot of innovation I didn't mention. We were accepted into this new model of care called the guide model that's introducing a value-based payment and implementing a new standard of care for dementia care that really is focused on caregiver support. And to be able to deliver against these pretty intense care delivery requirements, technology has to play a role when it comes to communication and access. So, yeah, I mean, I guess the short answer is absolutely. I don't know how else we meet the demand. It's not working today, and technology is, our sort of best opportunity. It's a multiplier, force multiplier, efficiency driver, value creator. I think companies that are leaning into how can we use it to enhance what works really well about healthcare, which is the human to human connection will succeed ultimately.
And when we talk about the shortfall, with clinical personnel, is it across the board, doctors, nurses, even the clinical sites themselves?
Yeah. Yes,
Mm.
yes. Yes, absolutely.
Okay, well, let's end on this. Let's talk about the company itself, Nolia Health, and where it's available, and if people were interested, how can they find more information? So you're in Washington State, and you said you're expanding to California.
We
Are you
are.
there?
Yep, we're
Mhm.
in Washington State, expanding to California later this year. We accept traditional Medicare and kind of all forms of Medicare Advantage plans. You can find us at noliahealth.com or on socials, Instagram, TikTok, Nolia Health. If you are a family caregiver taking care of a loved one living in a Washington or California, you
Mhm.
don't have to be located in those places. Everything we deliver is through via telehealth. So we can meet you wherever you are. But yeah, we would love to support you. You don't have to walk this journey alone, as so many people do. And yeah, we're really focused on delivering kind of the clinical, practical, and emotional support that family caregivers deserve in navigating what can be a pretty overwhelming experience.
Yes, it can be. And great. Well, I look forward to seeing the launch into California. And yeah, it's been great talking with you, Liz, and learning more about the company and how AI and tech are being used in the caregiving space. Thank you so much, Liz.
Awesome. Thank you so much, Alastair. Great to be here.
That was Liz Tarullo at Nolia Health. If you've ever found yourself caring for an aging parent, as many of us have, you know how tough and overwhelming that journey can be. But Liz and her team are showing how startups can step into a business challenge, step into a healthcare challenge with clinical expertise and a mix of tech enablement and founder conviction. Hope you found some takeaways here, whether it's spotting tailwinds in policy, thinking about how AI can extend human care, or maybe simply remembering that personal stories can often be the spark for a new venture opportunity. Thanks for listening to the Venture Variety Show. If you enjoyed this podcast episode, please hit like and subscribe and follow us for more on YouTube and my Substack channel. Also, please share this with a friend and check out the companion story on Substack for more on AI in healthcare. That's it for now. Thanks for tuning in.